How do we treat osteoporosis? I'm a nutritionist by trade. I'm a registered dietitian, and I would love to be able to tell you that you can treat osteoporosis through lifestyle behaviors, but it's not true. Osteoporosis is a metabolic bone disease. And what that means is that the bone cells change as we age and as we go through menopause. And so we naturally start to lose bone density despite our best efforts. So we really need medications to really treat osteoporosis and lower your chances of breaking a bone. The good news is that there are a lot of medications. We've been doing this for a long time, and there are all kinds of medications out there to suit your needs. And the thing you need to do is find a doctor to talk with you about the medications that might be right for you. That changes over time. We very rarely leave people on the same medication for lots of years, 5, 6, 7, 8, 9, 10 years. So you want somebody who really knows how to use those medications properly. You may go on one for a while, build up some good healthy bone density, then go off of it for a while so that you can prevent any potential side effects. So one of the most important things I can recommend is find a doctor who has a lot of experience in treating osteoporosis.